So, does this podcast make you guys feel like rock stars?
Oh, yeah, absolutely.
Oh, my God, yeah.
All right.
Parties.
All right, you ready? Welcome once again to Free Associations from the Boston University School of Public Health, the Public Health and Medical Journal Club podcast for anyone who is confused by the latest health study as I am by how we could have COVID models that do not accurately predict what is happening today, which is something that actually happened during the early days of the pandemic. We had some models which had incorrect predictions for the actual day that it was, which I found fascinating. I bring this up only because today we are going to be talking about COVID models. So I thought that was an appropriate introduction. Nick, I need some sound effects here. Yeah, see, Nick has sound effects today, so we're going to use those liberally throughout. No, we're not. Anyway,
I provide my own sound effects.
Yeah,
Thank
Chris doesn't need any laugh track. Chris provides his own laugh track. So I am Matt Fox from the Departments of Epidemiology and Global Health from the Boston University School of Public Health. And we have what I'm going to call a special guest, but is really just our returning regular host, Dr. Chris Gill from the Department of Global Health, back from his sabbatical, but only temporarily. Welcome back, Chris.
Yeah, hi. Hi, Matt. Hi, Brooke. It's really nice to be here. How are you all doing?
Doing well. Chris, how is the sabbatical going?
Well, I have to say that I think the Netherlands are wonderful. I was so happy being there. Happy, of course, to be back, but I'm also eager to go back and continue the sabbatical.
Yeah, so Chris is not done with this sabbatical, so we just have him here
for a couple of months to be with the family and do summer vacation stuff and all that stuff. And plus, there were many life events. My mother and mother-in-law both had their 80th birthday party.
Oh,
and
fantastic.
2 daughters graduated from institutions, and there were other birthday parties as well. And we have a wedding coming up at the end of August.
Do you want to give our listeners an address where they should send the gifts to?
Sure.
Yeah.
You could send them
don't do that.
801 Mass Ave.
There you go. Okay, so we also have a fantastic guest today, which is Dr. Brooke Nichols from the Department of Global Health at the BU School of Public Health. Welcome to the podcast, Brooke.
Thanks, Matt and Chris. And Chris didn't mention that the summer in Europe also just empties out, so there's no reason to be there. Netherlands is gone.
Yeah, this I find fascinating. Like when you go to cities like Paris in August and all of these businesses, like it's prime tourist season. And then you see all these businesses that are like, sorry, we're closed for 4 weeks because we're going on vacation, which I totally understand. But at the same time, it's you would never see that happen in the USA. So the reason, well, other than that she is fantastic, the reason we are having Brooke here with us on this particular episode is we are continuing on our series that we are doing related to the strategic research directions that the School of Public Health has. And I mentioned this on the last podcast. There are 5 areas that our school has been investing in. Those are cities and health, climate, the planet and health inequities, mental and behavioral health, and infectious diseases, which is why we have Brooke here today, because we are going to talk about COVID modeling. She is a COVID modeler. She's a modeler in general, and she is the person that I turn to whenever I have my modeling questions. So we are going to continue in that vein. So now on to the show. So today in our first segment, which is our Journal Club segment, we're going to look at a COVID modeling study. And this is a historical study. So we're going to go back to the beginning of the pandemic for this one. Then in our second part of the podcast, that's our deep dive, we're going to pepper Brooke with questions about modeling and the importance of modeling and why they are something that we should all be paying attention to. And then in our third segment, which is our amazing and amusing, which Chris still insists on calling the weird wacky, we will get into some things that make us laugh out loud or we just find fascinating. So, segment 1. So we're talking about an article, as I said, that was a model of COVID transmission. And I just want to make the distinction for our listeners who may not be as familiar. These kinds of models that we're talking about today are very different from the kinds of models that I am typically working with, which would be a statistical model where we're trying to find patterns in data to be able to identify causal relationships or maybe just describing what's happening. Here we're talking about models where we actually try to project out into the future what is going to happen based on what we understand about the dynamics of how infectious diseases move between person to person. They can be applied to other things, but I think infectious diseases are the place where you'll see them the most. The study was published in Science, and this was in April of 2020. So think back to beginning of the pandemic when we were really trying to understand what was coming. And I will say those of us who had to go on the BBC and various other media outlets at that time and say what we thought was going to happen. I don't know about you, Chris, but I said some things that I really wish I could take back.
Can you give us an example
I
of
said,
something you feel like you got wrong?
I think it was roughly in February, I said something along the lines of, there clearly is something going on. It's not good, but I really think we're going to be able to contain this thing. I really do. I wish I could go back and not have said that.
Yeah, I think my first public proclamation about this was in the first lecture of my Global Health 760 class. And the outbreak had just started, and I was following the posts, I think, from the South China Daily News, which at that time was remarkably progressive, and I think they got shut down later. But at the time, they were a fantastic source of news. And then I said to my students on that first lecture, in my professional opinion, I think we're in for a really, really tough ride, and this is going to be a disaster.
And you were correct.
And I was correct. But that was not based on any modeling. That was purely empiric. Like, I think this is going to be a problem.
No, but so let me just tell you this, Chris. I don't know if I've ever told you this, but my sister-in-law, who listens to this podcast quite a bit, you said on this podcast somewhere in the neighborhood of, I don't know, March, I don't remember when it was, you said how bad this was going to be. It was when we sort of first went into remote. And she says that is the first time when she realized, when you said it. Before that, she was like, it's probably going to be okay.
So there's a member of the Fox clan who actually takes me seriously? That is a terrifying thought.
Not Fox, but it's my sister-in-law. But yes, there is somebody out there who does take you seriously.
What's her name?
I don't think I should be saying names on air.
Well, to Matt Fox's sister-in-law, I appreciate your confidence, and I sure wish I had been wrong about that one.
Yeah,
but it turns out I was spot on that this was bad.
My first proclamation about my vision of what was going to happen with the pandemic was back in January of 2020, towards the end of January, where we had a faculty meeting with the lunch hour, and everyone was talking about various things. And I said, this coronavirus is going to be a big deal.
It's going to be a big deal. Yeah. A number of years ago, now since we're going off into reminiscence land, I'd gone to an academic conference in Vancouver, Canada. And there was this terrific bar/nightclub place where they had live music, but they also had paint your own easel. Yeah, they give you easels and paints, and you could paint terrible paintings. I never
paint. You don't paint the easel.
No, you paint the canvas, but it was one of those thematic, just like painted plate for adults. But anyway, and so I'd gone there, and it's all shared tables because it was it's very sort of chummy and Canadian, and I was sitting next to or across from this man and woman. And he was very sort of sullen and didn't want to talk and kind of stared away and wouldn't make eye contact with me. But she was very sort of, initially kind of politely chatty because he wasn't talking and I was, I talk all the time. So it was easy for her to have a conversation with me. And she said at some point, so why are you here in Vancouver? And I said, well, I'm here to attend a conference. And she's like, are you like an actuary or a vacuum salesman? Like, what sort of conference is this? Like, boring middle-aged guy that you are. And I'm like, oh no, I'm here for an infectious disease conference. And she's like, oh, infectious diseases, that's really interesting. And she's like, so like, what is the worst infectious disease you've ever seen? And we got into this sort of description of like really, terrifying things that I'd seen in my clinical career. And now the guy was very interested. And it turned out that she was a producer and he was the lead actor for Stargate. That science fiction TV serial. Yeah. And so I got to meet them and we spent the entire evening talking about infectious diseases. And at one point they said to me, what do you think is like, what is your sort of nightmare scenario? And I basically described coronavirus.
Yep.
That, some sort of influenza-like, much more aggressive virus that spreads easily through aerosols, that's going to be the one that causes a global catastrophe. And I hate again to say that I was right. Though I was not, alone in this. A lot of people were saying the same thing, including the people of the Office of Pandemic Preparedness, who were all fired by former President Trump before the pandemic. Brilliant timing, I would say. Yeah. So here we are.
Here we are.
Okay,
so I think this is officially the longest intro to a paper we've ever had.
Brooke wants to say something.
Oh, Chris hates saying that he's right.
Chris, I hate saying that I'm right.
Chris has always hated saying that he's right.
Yeah. I hate that so much.
Okay, so the title of the study, so it was published in Science. It was called Projecting the Transmission Dynamics of SARS-CoV-2 Through the Post-Pandemic Period, which, I mean, the fact that we were thinking about the post-pandemic period in April of 2020 is already amazing to me. So this was first author Stephen Kistler of the Departments of Immunology and Infectious Diseases across the river from here at the Harvard T.H. Chan School of Public Health. So again, this was April of 2020.
I think actually we're on the same side of the river.
Oh, right. Sorry. Harvard is across the river. The School of Public Health is actually on the same side of the river.
They're on the other side of Huntington Avenue.
Yeah. So all of our Boston listeners will know that, or all of our listeners who spend time in Boston. So there's a couple of headlines on this one. So this is from August of 2020. MSN says, the coronavirus is never going away. Yahoo News from August 12th of 2020, coronavirus, does the common cold protect you from COVID? Obviously, these were headlines that were taking on, they weren't just specifically reporting on the paper. And then another one from MSN, America's COVID-19 summer was terrible. Here's why winter 2020 could be worse. And then later in September, how we survived the winter. So going back to all of these earlier papers. So Brooke, Chris and I, had a little bit more trouble reading this paper because it's complex and the methods are not methods that we typically work on. So can you talk us through what they did in this study and what they found?
Sure. So this paper was trying to do a number of things. So first is trying to figure out how much SARS-CoV-2, the degree of seasonal variation, that seasonal variation would affect transmission, the impact of the duration of immunity, and also the degree of cross-immunity between SARS-CoV-2 and then other circulating seasonal coronaviruses. And so that was sort of the first thing that they were trying to do with their modeling. And then the second part, what they're trying to do within this paper, was to see what the impact of different types of social distancing measures, what those would have on sort of the peak intensity and the duration of epidemic waves with and without seasonal forcing. So really looking at the impact of seasonality on transmission.
Sorry, can I just stop you there? Can you explain what seasonal forcing is? Because that was going to be one of my questions for you.
Same here.
So seasonal forcing is really when, so for example, for flu, we always have a flu season that occurs in the end of the autumn, for example. Mm-hmm. And that happens, that's in the Northern Hemisphere in certain areas, so it's not across the board. But that's when sort of the weather and people's behavior come together to increase transmission. So either people are moving indoors because it's cold outside and everyone's now congregating inside, and or the humidity and temperature also aid aerosol transmission during that time period. And that is depending on the virus. And so you'll see this at different times, different timings for different viruses, depending on also what's currently circulating. And so seasonal forcing is really all about people's behavior and the actual temperature and the season itself, humidity, et cetera. So there seems to be there is seasonal variation for a lot of influenza-like illnesses, ILIs. So for flu, for example, but also seasonal coronaviruses. So seasonal coronaviruses also have these wintertime outbreaks as well. We also see these in schools and stuff. And I think originally, back in the day, February vacation and Christmas vacation from schools were really designed to help get all these diseases out of the schools and then come back to school so that we could start fresh without continuing
that's interesting
cycle of transmission within schools. And so
I didn't realize that.
It's kind of like a lockdown, a periodic lockdown to sort of reset the infectious disease clock.
Whereas now it seems to go the opposite direction. These breaks tend to increase transmission because people then, go away and travel and start. Well, they have, I should say. Anyway.
They could bring back new things, or they could transmit it to older populations if they're on breaks with other older family members. So it really does depend on the sort of immune profile of people they're interacting with and the type of pathogen we're talking about. Mm-hmm. But in general, because you start to see lots of kids losing school days towards the end of the season, like, okay, we need a break. And then we start over again. So in order to address those, they created a deterministic compartmental model. And so this means, I think a lot of us have heard of SIR models where you are susceptible, you can then move to be infected, and then you can be recovered. And so, the way that people move between compartments is how infectious the virus is, how many contacts people have, sort of the duration of infectiousness, and the actual infectiousness of a given individual at a moment in time, and the number of people that are currently infectious, because the more people that are currently infectious, the more transmission that can occur. And within a typical SIR model, once you move towards the R part, assuming that you could so once you're recovered in a classic SIR model, you're assumed to be immune. So these people can no longer get infected, reinfected, etc. And so within this model, they also looked at the SEIR part of the model, which the E is exposed technically, but it's really trying to capture this pre-symptomatic transmission that occurs. And that's really what drove a lot of the transmission for SARS-CoV-2, was this pre-symptomatic phase where people felt mostly fine or completely fine and continued about their business and then could transmit in that time period. And so that's sort of the critical component of these models for SARS-CoV-2, as compared to SARS-CoV-1, for example, where there wasn't that pre-symptomatic transmission period. And so the authors in this paper also had SEIRS model. So they allowed people, after they became recovered, to be susceptible again. So this is more closely what we ended up observing in real life. Yep. I know for myself, I am part of that circle of recovered to susceptible again and infected again. So
have all three of us had it at this point, and Nick too?
Nick has not.
What?
I have.
How many times?
Once to my knowledge.
Twice.
Brooke, twice. Okay.
4 vaccines, 2 natural infections. I am full of immunity.
You got a lot of it. Yep.
But maybe not to anything that's currently circulating. So
exactly.
Anyway. Okay. So they developed this SEIRS model to be able to look at multiple circulating pathogens at the same time. So really, I think one of their initial hypotheses was that if there is some sort of cross immunity to the existing circulating seasonal coronaviruses, that could affect what we see in terms of a peak epidemic, the number of people that would be infected at a peak of an epidemic wave, and the likelihood of seasonality of the virus going forward. And so to do this, they basically created this compartmental model to allow for people to be infected with one or the other, and then allowed for cross immunity between the two to differing degrees. And so that's what differentiates this model compared to sort of a classic SIR model. And so in the first part of their work, they look at the effect of depletion of susceptibles and seasonality on the effective reproductive number by strain and season.
Okay, so can you tell us what the effective reproductive number is?
Yeah. So the R naught, so the reproductive number at time 0 when an entire population is susceptible to infection. That is, if I'm infected and the population is completely susceptible to infection, the R naught is on average how many people I would go on to infect with this given pathogen. And so in the beginning of the epidemic, the R naught was thought to be something like 3, 2.5 or 3. And then the effective reproductive number is what is the reproductive number at time X or time T. So wherever we are at this point in time, because that is also dependent on the number of people that have already been infected, the number of people that are immune or have some cross immunity. So when the population is no longer completely susceptible, and we can modulate the effective reproductive number by social distancing, by masking, by vaccination, testing, and isolation, all of these different measures. So all of that can modulate our effective reproductive number. And so within this paper, they were looking at, well, what does seasonality do in terms of the effect on the effective reproductive number? So at different parts of the year, where do we expect to see increased transmission due to the seasonality alone? So an increase in the effective reproductive number, versus when do we expect that effect to be less? And then they looked at that, as well as the effect of cross immunity between 2 seasonal coronaviruses. So not SARS-CoV-2, but
common cold viruses, basically.
2 common cold viruses. Yeah, exactly. And then in the beginning, they're really demonstrating the impact of that seasonality and seasonal forcing has on the reproductive number, sort of overshadows to some degree, at least in the beginning of an epidemic wave, the effect of cross immunity. And so I think that was sort of showing the dynamic effects that these 3 things have in common. So the dynamic effect between time of the season and cross immunity of more than one pathogen and what to expect there. Now we bring in SARS-CoV-2. So is it possible that it can proliferate at any time of the year? And they're able to show that is in fact possible. And spring and summer establishments of the virus would favor outbreaks that have lower peaks because of this seasonal forcing. So if SARS-CoV-2 were seeded in, let's say, April, May, then because of the seasonality and the fact that it's not sort of the season for a seasonal coronavirus or what have you, then we would see sort of a lower peak than we would if it were seeded, if the sort of the new wave were seeded in October, November, and we see a much greater wave, much larger wave. So that is the first thing that they were able to show, was the introducing SARS-CoV-2 into their model. The second thing that they really looked at was immunity to SARS-CoV-2, and that if immunity is not permanent, it will enter into regular circulation. So SARS-CoV-2 will be with us for basically forever if immunity is not permanent. And that was the second thing that they were able to show.
Which is where we ended up with not complete immunity. Yep.
Exactly. And what's interesting, I mean, they also describe in the paper that the duration of immunity to the seasonal coronaviruses is about 1 year. And I think that the evolution of the pathogen so far has sort of outpaced that. I mean, so there's the duration that we have, our duration of immunity to what we've been infected with or immunized with. Really don't know how long that lasts for each of the previous variants that we might have had. So I might still have some residual immunity to what I was infected with from Delta. But now that I'm being exposed to entirely new pathogen, let's say BA.5, I'm still completely susceptible to that. And so I might still have this duration of immune response that might be a year or longer to Delta, but now I'm being exposed to basically a new virus. So my previous immunity doesn't matter. But I think it was interesting that they used that 1 year as sort of a baseline of potential immunity from this. And then the reason sort of that we see infection wave after infection wave might be different from what they show in this paper, basically the evolution of the pathogen rather than duration of immunity. But I think that that's sort of an interesting concept and important concept. Then the third thing that they showed was that high seasonal variation in transmission will actually lead to smaller peak incidence during the initial pandemic wave, but then could result in large wintertime outbreaks. So this is, a little bit based on when we're seeding the epidemic and what we would end up seeing. And so it's hard to know what actually happened because there were so few diagnostic tests available back in the first wave.
Right.
And so between social distancing and hard lockdowns and all of that, the actual proportion of people infected during the first wave back when it was seeded in March, April, it's really hard to figure out whether or not that's what actually happened. But I think the point that something seeded in the spring or summer would have a lower peak intensity. Then their fourth finding, if immunity to SARS-CoV-2 is permanent, the virus could disappear for 5 years or more after causing a major outbreak. And so I thought this was also particularly interesting. So if immunity were permanent, basically, until everyone is infected, or the majority of people are infected, such that the effective reproductive number cannot come above 1, then you'd see a complete fizzling out of circulation of SARS-CoV-2 after a certain number of years. And this does make sense. And then sort of the reason that after 5 years, you'd see potential new outbreaks is the growth of the susceptible pool. So people are born, and then after 5 years, you have this sort of a certain critical mass of people children under the age of 5 that could then sustain a new outbreak of SARS-CoV-2 in the future. So that is related to their fourth finding. Yeah. And then the fifth one, which I thought was very interesting. I don't think this is the case at all, unfortunately, but it would have been interesting that if you had SARS-CoV-2 and it were to provide cross immunity to other pathogens, but the immunity to SARS-CoV-2 were permanent, that you'd actually also see dying out of the other seasonal coronaviruses. So,
so in other words,
that would have been damn cool.
In other words, if this had led to both permanent immunity to SARS-CoV-2, but it could also, in theory, if this were the case, it would also, you'd see the disappearance of common cold.
Yeah.
Or at least these two
common
two
cold
causes.
caused by these two pathogens.
Yeah. Oh, exactly. That's so interesting. Too bad that didn't work out.
Yeah.
Right.
Too bad.
Yeah.
But one might argue that if that were true, surely we wouldn't have had SARS-CoV-2 in the first place because of the presence of these two other circulating coronaviruses. I have to say, this was a theory that always sort of stuck in my mind and got a little bit sort of jammed up there. That the postulation of effective cross immunity to circulating coronaviruses that cause the common cold. Why then would we have an outbreak of SARS-CoV-2 if that were true? So I guess I'm disputing the theory.
Well, you can have different theories of cross immunity, right? So cross immunity from one seasonal coronavirus to another is not the same from that back to the other one. So you have different levels of cross immunity, right? And so, and I think also the theory that for SARS-CoV-1, that there was very long lasting immunity. And then I'm not sure the extent to which SARS-CoV-1 also conferred any cross immunity to seasonal coronavirus. No idea, but worth looking into.
Probably not enough people infected for us to know that one.
Yeah, I mean, there was never an opportunity to test the theory because SARS-CoV-1 happened and didn't recur. So we can't say that there was long-lasting immunity because the outbreak ended.
Right. Good point.
The virus went extinct. So,
good point.
We could go and find those people and expose them and see if they're truly immune, but people might object.
But if we could look at their blood over time, if they were collected in a sero study, you could then look to see if there were presence of seasonal coronaviruses over time. Anyway.
Super complicated.
Okay, so did we hit all the major points from the study?
That was, I mean, those were the big ones in terms of the interaction between the seasonal coronavirus and SARS-CoV-2. Then they go on to look at the impact of different types of social distancing and effect of social distancing on R-naught in reducing peak transmission, and really looking at sort of the duration of social distancing measures and other measures put in place. And then essentially showing that really social distancing, you have to put it in place for the whole time if you want to see an effect. Otherwise, the coronavirus will just come back.
Yeah.
And that was kind of shown, I mean, that's true. That's what happened, right?
It really, I mean, that seems to me that one of the things that very clearly they got right in this model for sure. Yeah. Not that the other things are necessarily wrong. These were what if scenarios. These were not meant to be, this is what's going to happen. These were, if this is true. And one of the things I wrote down was I liked about this paper was that so much of it is, if this, then this. It wasn't saying, we know, because it was too early for us to have known. But I do worry that some of the models get interpreted as we know, and so this is what's going to happen. And then if it doesn't happen, we say, oh, you don't know what you're doing. But predicting the future is hard.
Absolutely.
Okay. All right. So we have this paper and we're looking back on it. And I mean, it's very easy to Monday morning quarterback it and say what you would do differently if, you could go back in time knowing what you know now. But, let's start from the standpoint of given where they were. Chris, you and I both read this paper and probably had far less ability to critique it, but I am curious what your thoughts are when you were reading this, or if there are any things that you want to ask as follow-up questions.
Well, of course, the most interesting part of this is to go back and sort of
Monday morning quarterback
it, right? So of these, I think they were very careful.
They were
not to say this is what will happen. This was like A Christmas Carol and the Ghost of Christmas Future. We're seeing things as they might be, not as they must be. And so, and they caveat that all over the place because I think this is how these papers can be easily misinterpreted. That we are, this is not the Oracle of Delphi. They are saying under these sets of assumptions, given our current understanding and our current knowledge, and these parameters that we put into our model, and recognizing that there are many others that we don't know, what might happen. And I kind of feel like this is maybe a point where I would love to hear Brooke's take on this, because the criticism of models always seems to be that they are treated as if this is from the Oracle of Delphi. And when things don't turn out, people then say, oh, see, you can't trust models. But I think that's not what the models, at least the careful modelers, are trying to say. So I'm going to pass to you actually because I have lots of other things I want to say, but I think this is a really important point that I'd love your perspective on.
Yeah, I think a really sort of good modeling studies show, especially if we're trying to show what might happen in the future with all the uncertainty, really careful modeling studies such as this one shows states we don't know all these things. But if certain things are true, this is what it will look like. And that kind of helps us as we go forward and we learn new things. We can even look back to a paper like this and say, okay, we know there's no cross immunity between seasonal coronaviruses. So we're going to not look at figures 2A through 2C or whatever it might be. But we might be able to still learn something from 2D and 2E because that might still reflect sort of the information that we have now and allows us to adapt what we think over time. But that would take a careful reader and interpreter of the work, as well as the careful modeling and presentation of the modeling such that they have done as well. And I think that often doesn't happen, and often sort of news bits are pulled out from articles and amplified rather than sort of the nuance of what it could mean. And I think interpreting nuances is always difficult, especially for large audiences.
And so, Brooke, what is the What is the value of a paper like this in April of 2020 when we don't know all that much at the time? What is the value of a paper like this in terms of decisions that people want to make? Because as you say, I mean, what this model to me says is, here are a bunch of things that we don't know. If we make certain assumptions, this is what we can expect. But we don't know which is going to turn out to be the right answers at this point. And so does this facilitate decision making in any way?
So I think the unknowns around the seasonal coronaviruses were probably, that was almost too unknown to be particularly helpful.
Mm-hmm.
But in terms of what they did, in terms of their work on social distancing measures and seasonal transmission and timing of when you need to enact social distancing for it to be effective, I think that was extraordinarily helpful for decision making. If people could read this carefully. And so, especially looking at sort of the duration and the importance of the duration of social distancing measures and sort of what you need to do and when. Most of the goal of their work was to look at making sure that critical care capacity was not breached, rather than trying to completely suppress transmission. And so I think they did a really good job looking or showing that this is what might happen if you only enact social distancing for a few months or for a few weeks, what you'd expect, especially going into the fall and winter of the following season. I think that was actually very helpful early on.
Mm-hmm. Yep. Chris, I interrupted you.
You did not actually. The comment I wanted to bring up at some point, and maybe I'll raise it today, is again another question for Brooke, which is that in these SIR models, R is recovered. But what we have learned about this virus and its many subvariants is how complicated the immune response to this virus is. And so that this term R, which is just a number, doesn't seem to capture it very well anymore when we're dealing with something where, there's a substantial disconnect. You are a perfect case study, right? 4 vaccines and twice infected. And I wouldn't be surprised if you were infected a third time. It wouldn't surprise me or shock me in the least. And yet what would shock me is if you ended up in the ICU or dead. That would totally stun me. And so when we're thinking about immune, we are thinking about it in an entirely simplistic way using these models as a binary, that somehow immune equals non-contagious, whereas immune also means non-killable, and that those two are not the same, right? That it is a much higher bar to render one so immune that they cannot become infected and cannot transmit, compared with rendering someone with memory B cells and T cells that are capable of responding to an infection promptly, months or years after an exposure, as it turns out, and can rally in that moment and provide you with sufficient immunity so that you do not die or become seriously ill. Those are very different things, as it turns out. And I don't think I've seen an example of this quite so clearly before in infectious diseases, is where we have such a separation between infectable and infectious and the serious consequences of these diseases. And this is borne out in the media, which obsesses constantly about waning antibody levels. Mm-hmm. But it is not that simple, right? It is not that simple. And the antibody levels tell you something about your likely ability to resist an exposure, but they are not the ultimate measure of outcome by any means. And that seems to have been completely missed. And I'm wondering, like, now in the modeling community, how do you start to wrestle with this fact that R is not R, but it is sort of like it's a bunch of different things all happening at once? And like that seems to be taking something very complicated and making it even more complicated. But I'm curious, where do you go with that?
It's flipping complicated. And so one thing that we do is separate out susceptible compartment in general. So once you have recovered and then you are, theoretically susceptible again, you have different levels of susceptibility either to infection or to severe disease. We can separate that out and say, okay, if you've been vaccinated and you're exposed to variant X, what's the likelihood that you get infected given that you're exposed? You can also look at different pathways for people that have sort of vaccination or previous infection or both, and the likelihood that they end up with severe disease. And so it doesn't need to be, it's not like a 4 or 5 box model, but really like quite substantial in terms of different pathways. And a lot of how we've been handling this now in our modeling work has been to use an agent-based simulation model where each individual can have some combination of vaccination and previous infection. The problem is that we get into the space of the unknown of new variants. We don't know what new variants might look like. We don't know the level of cross immunity. But me having 1 J&J vaccine, 3 Pfizer vaccines, a Delta and an Omicron BA1, Does that give me more protection from BA5? I don't know.
Probably
And
to
I
some
think
degree.
we don't have enough like data to actually parameterize any of these models in a particularly meaningful way.
Yeah.
So, we're not going to be able to predict what the new variant is or looks like. And given sort of the vast heterogeneity in the underlying immunity of the population, it become excessively difficult. And so a lot of ways that we handle this now is modulating the effective reproductive number to account for differing levels of underlying population immunity to a new variant. That's sort of the main way to do it. And also including vaccination because of this very clear impact on severe disease and mortality.
I'm glad you raised that because it actually was another thought that had been sort of bouncing around, which is how differently this virus, this family of viruses, I guess we can call it. I don't even know if we can officially call it a virus anymore as opposed to a constantly evolving cluster of viruses, but how different our experience with this has been compared with, say, influenza, where the R effective for influenza in any given year is like 1.5 to 2.5. And it seems to live there forever. And sometimes it's a little lower, and it's like, that's still plenty infectious enough to cause an influenza outbreak every year and a pandemic every 10 years or so. But what we don't see is that the influenza virus responds to vaccinations and to natural acquiring immunity by ramping up its R effective, as we have seen with the coronavirus, that every iteration of variant has been more contagious than the one before it, presumably because it's responding to evolutionary forces such that only the viruses that are most contagious are able to spread. But its capacity to become more and more and more contagious as community-wide immunity rises is astonishing to me, because we don't actually see that with many other diseases. This is a really new thing in my view.
Yeah, and I don't think it's that necessarily that SARS-CoV-2 is becoming more and more and more transmissible. It's just it's evolved to evade immunity more and more. And so like the effective reproductive number, it's still not terribly high, but just the susceptible pool with each new variant has grown dramatically because everyone that didn't have BA1 is susceptible to BA5. And you could have had Delta, but you're susceptible to BA5.
I'm not sure I quite agree with that because I think it's both. Because when you look at the binding kinetics of the variants, what you find is that they're more effective at binding to their receptors, and so they are actually more contagious rather than less. And they've also changed in terms of the co-receptors that they bind to. So one of the reasons that the Omicron variants are so peculiarly infectious is because this sort of second population of co-receptors, by which I mean it's like you imagine a cell, it's got a receptor on it that binds to the spike protein. But binding to the spike protein, the virus binding, the spike protein binding to the ACE2 receptor doesn't allow the virus to enter and infect the cell. It requires a co-receptor to then bring it into the cell. And the second family of co-receptors is quite different from the earlier variants to the later variants. Such the earlier variants, the co-receptors were heavily represented deep in the lungs, which is probably why the virus was so much more lethal, because it was causing a viral pneumonia. Whereas the co-receptors that bind Omicron are predominantly in the upper respiratory tract, which accounts for why it tends to cause more of a common cold-like illness, but also why it is so much more contagious, because the receptors are right there at the point of contact. They don't have to penetrate deep into the lung to cause an infection. So there's a huge evolutionary advantage to shifting and that has actually driven up the R naught of the virus itself. It is more contagious than it was, not just as a fact that it has to, escape immunity. And that is also a part of this complex evolving, event going on. Yes, cross fingers. I agree.
Yeah, and they're intertwined, right? I mean, yeah.
Yeah, they're part of. It is a Gordian knot. Yeah.
Okay, so I'm just going to expand out. So we essentially, unlike in previous episodes, we've combined segment 1 and segment 2. And the one question I want to ask, Brooke, is so we've seen these models under a microscope like we've never seen before. I mean, this is probably something that the average person pays zero attention to when you're not in a pandemic situation, but when everybody is suddenly affected by something so earth-shattering as the early pandemic phase and the lockdowns, and everybody's watching TV and reading the media, they're really under a microscope. So I'm curious your thoughts on where you think the modeling efforts went well during the pandemic and where, there are sort of lessons we can learn.
Yeah. So where the modeling went well, I think in the very early days, there was too much uncertainty for almost any of the modeling work to be useful.
Sure.
And I think the amount of uncertainty in those results might have been communicated from the modelers themselves, but there's this big gap between the modelers themselves and being able to communicate uncertainty and people understanding uncertainty in modeling projections. And so the very early days modeling, I think, was, somewhere between helpful and not helpful.
Yeah. I just want to emphasize that point. I mean, I looked at the early models and I saw large uncertainty bounds. And, as somebody, I don't know modeling uncertainty bounds the same way I know statistical uncertainty bounds, but I know what uncertainty bounds generally mean. And so it seems to me that was the responsible and right things to do. But we as a field, and I'm here including all forms of epidemiology, don't know how to communicate uncertainty very well. And so that seems like it just got lost in translation, and it presented as if we knew with certainty, or people just wanted to hear that there was some, certainty to it because they wanted to be able to plan.
Yeah. And I think a lot of people, so especially in the global community, wanted to be able to plan. So the Essential Supplies Forecasting Tool, the ESFT, developed by the World Health Organization, they wanted numbers so that they could get, oxygen and PPE to the places that were going to need it, when they were going to need it. And sort of everyone was scrambling, people needed a magic 8-ball, like what's going to happen? And we need to be right, because otherwise the wrong things are going to go to the wrong places at the wrong time. And so I think there was an over-reliance on modeling estimates because there's nothing else to work with. I mean,
Well, but that seems to me important, right?
Yeah.
I mean, so it's one thing to say, we have a model and it has this much uncertainty, and so the public shouldn't really put too much faith in the specific midpoint of that interval because we don't know what's going to happen. But if you're a decision maker who's got to actually marshal resources and move them, you're better off with your best guess from a model than just throwing things anywhere. So it seems to me the models are absolutely essential, but it's when we go from what policymakers should be doing with them to what the public should be doing with it, or even in some cases what policymakers who don't really know what to do with those numbers do with it, that I think we run into trouble.
And also the fact that we need to continually update models as we get more information.
Mm-hmm.
And oftentimes people stick to what they were first working with. And so something might have evolved pretty substantially since the first time it was introduced, but the updated versions aren't integrated in the same way that they should have been.
Yep.
And I think modeling in general can be most effective when it can evaluate multiple different policy choices. Mm-hmm. So instead of being particularly predictive, we needed to do some type of predictive modeling to be able to send resources to the right places, and sort of a best guess is better than nothing, right?
Right.
But how models can and should be sort of used in the policy sphere, especially, so not just resource allocation across countries, but also, should we introduce rapid tests or not? Modeling can be really helpful to show, well, if rapid tests are introduced in certain places at certain times and people respond to these different levels of effect, this would be the effect that you could expect from rapid testing if people chose to self-isolate to some degree after a positive test.
Yep.
And then you can actually help see, okay, well, if we don't introduce this at all, this is what it looks like. This is what the epidemic looks like for the coming months. If we do introduce testing, only PCR, this is what it looks like, because it's limited by the number of PCR tests a country could do. And if we could introduce rapid tests, then we would expect Y. And then understanding sort of the expected costs and the expected impact of all those different strategies can actually aid decision making. But I think that often it's not used in that way, which is a shame.
Yeah. So, it seems to me there's a ton that we can learn, and these are incredibly useful models, but they also have to be interpreted with some caution.
Mm-hmm. There are two really great examples of that maybe we should comment on at least briefly.
Yeah.
One, I think, is the initial Ferguson model coming out of Imperial College in London, which, to paraphrase, said, if things go on as they are, if we do nothing, we're doomed.
Yeah.
I think that was the take-home message.
Yep.
And then the second one was the one that from IHME,
yep,
which said it ain't going to be so bad. And it was much worse than that. Mm-hmm. So both of them, well, one can't really argue that Ferguson's model was wrong because we didn't do nothing. And that was the point.
Exactly.
So we'll never know what would have happened if we had, in fact, done nothing. And thank God we didn't do nothing, because I think things would have been worse. But it's still interesting to think about these extremes, because both of those have led to sort of vociferous criticisms of the method, I think.
Yeah, very different approaches.
Very different approaches, and the more extreme model, the one that was a model of what's going to happen if we do absolutely nothing, and that was not a very realistic scenario, but it was meant to just provide this is what happens, this is what's going to happen if we do nothing. And I think it's been widely misinterpreted to mean this is what is going to happen, and that didn't happen,
and therefore they were wrong.
Yeah,
but that's not what they were saying.
I totally agree.
Right,
but
right.
So this gets to that whole issue of what the models say and what they mean can be very different from what people hear from them, and the way they get mediated through the media, and or just how people with agendas or people who hear what they want to hear or don't know how to interpret it come away with this information. It can be very different from what the models actually say, and so it's a complicated topic that I think we need to learn a lot more about when we face this scenario. If we face this scenario again, when we face this scenario again, when. All right, so we're out of time on those two segments, so I'm going to end that conversation there. But I thought that was really, really fascinating, and I love to talk more about this. So we are then going to move on to our third segment, which is our amazing and amusing. Chris, what do you got?
Well, I have two short things that are loosely at best connected that have to do with hot summers.
Okay.
And they are respectively drinking cold lager beer. And I like lager beers in particular because I'm not really a beer aficionado. My wife has a much finer palate, and she loves all sorts of complicated IPAs, and I just find them bitter and mostly taste like poison to me.
Yeah,
I like it.
I don't agree, but I understand.
I understand. I'm extremely lowbrow with my Lowenbrow. Mm-hmm. Anyway, that was terrible. Yes.
It was awful.
And the second thing, of course, is watching fantastic movies while you're drinking those beers, and they kind of go together. So I wanted to talk about one beer that I particularly like, which is Kirin beer.
I don't know this beer.
You do. It's the Japanese beer that you get at the sushi restaurant. That's got sort of like a flaming dragon monster creature with a flowing tail and flames bursting out of its mouth, I think.
Okay.
That looks kind of like a dragon/lion.
Sure. Okay.
It's called a Kirin.
Kirin.
Are you familiar with this?
I am not.
Beer, Kirin, it's Ichiban Shibori. No.
No.
It's I think it's probably the most famous Japanese beer. So Asahi could be more famous. I don't know. Anyway, it's a very popular beer in Japan and quite tasty.
Yeah. Okay.
The thing that I find really interesting about this is that the word Kirin in Japanese also means giraffe.
Okay. Well, Nick seems to know this.
His head.
Nick is aware of the giraffe connection. Okay.
Yeah, and I think that this is absolutely fascinating because the mythical Kirin, the flaming lion dragon god flying through the sky,
was not a giraffe.
Was less weird and more easily believed than the actual giraffe, which no one could wrap their heads around as being possibly true.
That there would be this creature out there with a
12-foot neck covered with spots that would eat leaves from the top of the trees. And no one was buying that nonsense at all. And so as it made its sort of like gigantic transcontinental over the Silk Road pilgrimage of the story of the actual giraffe, it morphed into this fire dragon god.
Wow.
And I think that is just like an amazing kind of game of like reverse telephone.
Yeah.
That happened, thousands of years ago. And the characters for writing the name Kirin in Japanese, and I assume it's the same in Chinese because Japanese characters are all from China originally, are etymologically very interesting too. I'm not sure if you guys study Japanese or Chinese characters at all. I assume you don't, but they're formed out of little smaller characters called radicals, and the radicals themselves have sort of some symbolic meaning. And so complicated characters are usually a combination of 3 or 4 different radicals. And sometimes they're put together just in ways that to make them phonetic. So like there's a dominant radical that sounds a certain way, and that's just, and it doesn't mean anything. But oftentimes they do mean things. Like the character for samurai, which is one of the few characters actually that originated in Japan as opposed to Chinese, is a combination of the temple and a man. So he's the man of the temple.
Oh, okay.
And so it's very interesting how some of them come to be. But the one for Kirin is very interesting because the left-hand radical in Kirin, in both of the first and the second characters for ki stands for deer. And then adding to that is an unusual sort of grammatical character that usually means like that or that person.
Yeah.
So it's like a declaration. It's like that deer. But deer is not literal. It's like they use the deer radical for all sorts of four-legged animals.
Okay.
Deers, cows, horses, whatever, all sorts of different, probably not horses actually, but many, many, many animals have the deer radical in their name. And so it's not actually saying this is a deer, but is referring to the giraffe. Right? That weird deer. And the second one also has the deer radical in it, but then the two subsidiary radicals, one is for rice and the other one is for outside. And the rice radical actually refers to the West.
Okay.
So where it came from, Africa.
Oh, okay. Yeah.
It came from the West. The story came from the West. And the outside is obvious. It's like it's not West and not from here.
Yeah.
So it is that weird deer that came far from the West that is not from here. That is what the word actually means if you look at the radicals.
Very interesting.
And I think that is like super cool. And the other thing I wanted to just comment on is my very favorite movie of all time is The Third Man by Carol Reed. He's the British director Carol Reed. And it takes place in post-World War II Vienna. And it's all about smuggling of penicillin and skullduggery and this sort of weird murder. And it's a fantastic movie and it's got beautiful cinematography. But the thing I love about it is that the screenplay was written by Graham Greene, the famous British author. Who wrote quite a number of books that became screenplays. But this one was unique in that he wrote it as a screenplay, not as a book that became a screenplay.
Okay.
And it is one of his most famous, of course. And the cool thing I think about this whole sort of Graham Greene writing this book is that Graham Greene, in addition to being sort of an insightful observer of human nature and the gritty underside of things and the nature of man and the nature of our souls, even though he was an agnostic. He had this very singular writing style. And one of the funniest anecdotes I know about Graham Greene is that in 1949, there was this magazine called The New Statesman that had a Graham Greene writing contest where people would submit entries to sound like Graham Greene. And he, under pseudonym, entered this contest and lost. I think it's very funny. He did get second prize, so he did pretty well.
He did okay.
He did pretty well.
He's an okay Graham Greene.
And in 1965, he did it again under a different pseudonym, and then this time only got an honorable mention.
Oh, but he's not the best Graham Greene out there.
The beautiful irony is that the two paragraphs that he submitted as this is trying to sound like Graham Greene, he actually used in a novel that he published. So later on, I mean, it hadn't existed yet.
That's very
and I thought
funny.
that was very funny, and I was curious whether there are others like famous people who had failed to be recognized for who they are. And it turned out that Charlie Chaplin, who was a friend of Graham Greene's when they lived together in Geneva, of all places, they were very close friends somehow, and he had entered a Charlie Chaplin lookalike contest and came in third. So I think these things happen a lot. Anyway, that's all I wanted to.
I love it.
They've got nothing to do with anything. But
no, they don't have to. They don't have to. We don't expect that from Chris.
Yeah.
All right, Brooke, what do you got?
All right. So something I thought was sweet and entertaining. So I think Chris and I were both present in the Netherlands during a very big storm. So, and by storm in the Netherlands, they mean wind. It doesn't mean lightning. It just means wind. And headline from newspaper in Rotterdam that day, or on the news site, was the headline, "Wind blows hard, man loses hat." And there's a video of the man, his hat blowing off. Then
important stuff.
Man finds hat. Man reunited with hat. All like that makes the news in the Netherlands.
It's a classic story. Everybody can relate to it.
This reminds me of one of the words I've learned in Dutch, which is verschrikkelijk.
Verschrikkelijk.
Which means horrible weather. You hear this quite a lot in the winter. I heard it over and over and over, and eventually I looked it up and I was like, oh.
And the Minions movie, Despicable Me?
Yep.
Yeah.
In Dutch, it's verschrikkelijke ikke.
So, that makes sense.
Despicable Me. Yeah, see?
Yeah.
I love
Despicable
it.
weather.
Okay. All right.
This hurricane that Brooke describes happened quite early while I was in Utrecht, and I was working late that night. It was a Friday night, and I was, in the last one in the hospital. Everyone else had got the news that the weather was terrible and went home, and I didn't get the news because I didn't speak any Dutch at that point and had no contact with the outside world. So I was completely within my bubble. So I came out of the office at 7 p.m. and I was like, it was very windy, and I was like, oh my gosh, it's very windy today. And, the weather had been horrible for weeks. And so I was like, wow, this is, even for the horrible weather in the Netherlands, this is particularly horrible. So I got on my bicycle and started to ride home. And I was like, my God, it's windy. This is really windy. And I'm just struggling to even move move forward at all with the wind like practically knocking me off my bicycle. It's like, wow, this is really windy and the trees are down. I'm like, windy and kind of dangerous too.
Yeah.
And eventually
Chris
I got
completely
home.
ignored the stay-at-home orders.
Completely ignored. Yep.
Sounds like Chris.
The next morning, I learned reading the news that there had been a massive, this was the Washington Post or something, that there had been a massive hurricane in the Netherlands and a bunch of people had died after being hit by trees.
Oh, awful.
But,
awful.
I was completely unaware and just shocked at how bad the weather was in the Netherlands.
Yeah.
So...
All right. Well, so I'm going to skip mine today because I have one that I'm actually excited to talk about, and we are out of time, and I don't want to have to rush it. So I'm going to save mine for next time and call an end to this one. So, Brooke, thank you so much for joining us. It was a fantastic conversation.
Thanks for having me.
I'll see you back in the Netherlands.
There you go. So that is the end of our program. If you've got any feedback on this or any other episode, or you want to suggest a study or a topic for us to take on, you can tweet us at @PopHealthEX, or you can tweet any one of us individually. I decided I'm going to stop listing all of our individual Twitter feeds because I think people know them by now. Or you can find us on the Population Health Exchange website at www.pophealthex.org. We want to thank Leslie Talalian, Assistant Dean of Lifelong Learning at the BU School of Public Health, for supporting the podcast, and she is the source of my amazing and amusing for next time. And Nick Guler for sound editing and all kinds of fantastic sound effects, which you refuse to use, and I am very upset about. You're going to have to add them in after the fact. Thanks for joining us. We hope you enjoyed it, and we hope you'll download our next episode.